Any other board members present? Did I miss anybody? Can I please call another present to please very briefly introduce yourselves?
Jennifer Green, Director of Cumberland County Health Department. And I'll remind folks that today the county, we are actually live on Channel 5 today, and our board meeting is being live streamed.
Thank you.
Also in the room is Kelly.
This is Ashley Curtis, Deputy Health Director.
Good evening. Thank you.
This is Jeanette Council, Commissioner.
Yes, ma'am. Welcome.
Andy York, Accountant for the Health Department.
Thank you, Ms. York. Welcome on board.
Dr. Ojo.
Crystal Vincent, Director of Nursing.
Okay. Anyone else?
This is Dwayne Holder, Deputy County Manager.
Welcome on board. Are we missing anybody?
And Crystal Vincent, Director of Nursing.
Yes, ma'am. Welcome on board. Okay, all being said, let's take a minute silence to unwind and bring awareness to the present. Thank you very much. Good evening and welcome again. Please take a look at the agenda for today. May I have the motion, the first motion to please approve the agenda?
This is Council. I move we approve the agenda.
Thank you. Second?
This is Mr. Larch, I second.
Thank you. All in favor?
Aye.
Aye.
All right, thank you. I believe that we've all had the opportunity to go through the last meeting minutes from January 26, 2021 on pages 2 through 5. Do we have any questions?
If not, I'll make a
anything
motion to approve.
Thank you. Second?
I second.
Thank you. All in favor?
Aye.
Aye.
Thank you very much. Next item on the agenda is the approval of the 2021 Board of Health Handbook. And this was sent out via email to everyone. Have we had the opportunity to go through?
Yes.
Thank you. Basically, the purpose of the handbook is to provide both the new and the returning members of the Board of Health with useful information regarding the function and the responsibilities, the authority of the County Board of Health. Please take your time to read through and familiarize yourself with the operating procedures on pages 6 to 11. Of particular importance is the compliance with the public health laws and regulations on pages 12 to 27. Also read through the hearing appeal to the Board of Health as stated on pages 28 to 32, and the process of the Board of Health education on pages 33 to 36. If you have any questions at all, please let Dr. Jennifer Green or myself know, and we will try as much as possible to answer your questions. We hope the information in the handbook will prove to be very timely and very useful to both the new and old board members and also the Department of Health staff. Please mute your devices. We wish all of you, does anybody have any questions on the handbook? Any questions or comments on the handbook, please? Nothing much has changed from last year's handbook, and I wish everyone would read through it and familiarize yourself. And I wish all of us well as we carry out our responsibilities. Ms. Kelly will send out a copy of the handbook to everyone electronically by the end of the week. I would love for us, please, to sign and send a copy back to her, a copy of the attestation statement back to her no later than Tuesday, March 16, 2021. She's also available to answer any questions that you may have. Do I have a motion to approve the 2021 Board of Health handbook?
I make a motion to approve the handbook. This is Stacy Cox.
Thank you, Ms. Cox. Second?
Kenneth McMahon, second.
All in favor?
Aye.
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 Thank you. Please remember to sign a copy of the attestation statement and send it back to Ms. Kelly no later than Tuesday, March 16, 2021. Can I please call on Ms. Candy York to present the fee schedule for approval? Ms.
Yes,
Candy
ma'am.
York?
Good evening.
Thank you.
Yes,
Good
ma'am.
evening.
Yes, good evening. As part of the budget preparation process for fiscal year 2022, we are required to review our schedule of fees and recommend any proposed changes to the Board of Health for approval. So the Health Department staff did do a review of the local health department Medicaid fee schedule, Medicare fees, private insurance rates, and also the cost of vaccines. And at this time for the clinical fees, we are recommending no changes to the current fee schedule that was adopted for fiscal year 2021. The 340B drugs that we purchased, which are the long-acting reversible contraceptives, they were adopted in the fiscal year 2021 budget as acquisition costs, and that will remain the same. So that will be the only fees that will change each quarter as the rates change for the purchase of those medications. We also looked at the medical record copy fees and recommended no changes to those per copy charges to the patients. And we're only requesting a change to the environmental health fee schedule. There's no changes to the existing fees that are already adopted. However, we are requesting to add a new fee called a well driller callback fee. This is similar to the previously adopted pool inspection callback fee that we adopted previously at the same rate. The environmental health staff are currently having issues with well drillers requesting inspections, and they arrive at the site based on the scheduled appointment time, and the well is not ready to be inspected. So therefore, they're having to go back for second and sometimes third times to actually inspect the well. They're hoping with introducing this new fee for a callback, and this of course will be recommended to be effective July 1st, 2021, that will cause the well drillers to pay more attention to the scheduled inspection appointments and cancel them in advance if they're not ready to be inspected. And I'll be happy to answer any questions in reference to this.
So you said you can speak for 11. Atricia.
Pardon?
Did anyone have any questions for Ms. York?
No.
Okay, I have a question, Ms. York. How did you
Yes,
arrive at the $75 callback fee?
Okay. This fee is consistent in the same price that we charge for the pool inspection callback fee. And when we set that rate, we did a survey across the state of other health departments, and they had the similar fee, and we went with the same exact fee they have across the state at other health departments.
Thank you.
Yes.
Anybody else has any question, any comments? May I please have a motion to approve the fee schedule?
This is the attorney. I motion to approve the schedule.
Thank you. Second,
I second the motion, council.
thank you, Ms. Council. All in favor?
Aye.
Aye.
Thank you. Moving on to item 3 on the agenda. The floor is open to public comments, please.
We did not have anyone register for a public comment today.
Thank you. And if that's the case, we will close the floor for public comments. And may I please call on Mrs. Candy York again to present the financial reports as on page 38 through 43? Mrs. Candy York, please.
Yes, ma'am. Yes, so beginning on page 38, we have the statement of revenues and expenditures for the month closing January 31, 2021. At the close of the month, our revenues exceeded our expenditures by $527,304.65. On page 39, it is expenditures listed by program. And at the close of the month, we had expended 46.83% of our budget. We're, of course, a little shy of 100% budget usage as always, but of course, that's always due to lapsed salaries, vacant positions, and also the timing of certain expenses. Beginning on page 40, you have your revenue by source report. On page 40 reflects your state and federal allocations, revenue received to date, and also the grant revenue. On page 41 is your Medicaid and your fees listed at the top. Also, at the bottom is your fund balance and county funds that have been allocated and expensed out to the health department. And then, of course, final, your total revenue earned to date. On page 42 is your accounts receivable report by payer source by program. And then finally on page 43 is the agent report for our self-pay patient account balances. And I'll be happy to answer any questions about any of the reports.
Thank you, Mrs. York. Any questions, comments, please, on the financial reports? Thank you, Mrs. York. Can I please call on Dr. Jennifer Green to please present the director's report for us? Dr. Green, thank you.
Good evening, everyone. We're just getting slides up. All right. So we'll start with our COVID update, and this slide shows our cases over time since the beginning of the pandemic. So this chart looks a little bit different than what we have seen in previous board meetings. The state dashboard has just changed just a little bit of the way that the data is the same, but the graph just looks a little bit different. So the trend line is gone here, but you can see over time the cases by day. You can see where we peaked a little bit over the holiday season. And then since then, in positive news, we've seen some pretty sharp declines in terms of the number of our cases. But I want to reiterate that we are not out of the woods yet by any stretch of the imagination in the pandemic. We are not at, I'd say, pre-holiday level or pre-summer levels. We're not back to where we were in July or even last spring quite yet, but the trends are consistent with what we're seeing statewide and what's going on nationally with declines in cases. We've had in the last 7 days, I pulled this data down yesterday. So in the last 7 days, we've had 848 cases compared to the previous 14 days where we had 2,413 cases. So some positive trends there. The chart on the bottom shows the number of deaths that we've had by day. So you can see that over the last couple of weeks, we've actually had some increases in our death data. And that's not concerning, of course, not surprising, as our case peaks in cases, deaths can tend to lag by about a month or so behind the peaks in cases. So I think that's what we're seeing now. Our case positivity rate is about 10% when I looked at this yesterday. So that has been a significant decline over the last couple of weeks. Pre-holiday season, pre-Christmas, New Year's timeframe, we were, and just thereafter, we were up to about 17 or 18%. So we've come down to approximately 10%. So that's not where we want it to be. We want that to be closer to the World Health Organization recommendation of 5%, but that number is declining, so that's a good thing. On the next slide, you'll see our testing data. So this shows the number of tests that we performed since the beginning of the pandemic, week by week. And then as always, that last bar is an incomplete week, so that's why it always looks a little bit less than the others, because that is actually for only, the last bar is always only for a half week. But you can see that we've performed close to 10,000 tests over the last 3 weeks. So even though the health department, we suspended our test site at the end of December, we haven't seen a drop in the number of tests that are performed community-wide. And indeed, our vendor that we work with through the state has maintained some of our testing sites. So you can see that on this chart. So now on the next slide, we'll take a look at where we are with current vaccinations. At the last meeting, we looked at the current vaccination groups, and the state has simplified the vaccination groups. So the two active groups are healthcare workers and long-term care facility staff and residents. That's group 1. Group 2 is the second group that is active. That is our older adults that are over the age of 65. And then our next group that's coming up down the pipe very shortly is our frontline essential workers, and we're going to talk about that in just a moment. And then following that group will be our adults that are under the age of 65, that have some underlying health conditions, and then other essential workers that don't fall into group 3, and then everybody else will be in group 5. So on the next slide, we will, and if you will mute your mic if you're not, we're getting a little bit of feedback in the room. We're going to try to mute you. If you're on the phone, it might be if you're on the phone, please, we are not able to mute you if you've called in. So our current vaccination efforts are actively vaccinating in groups 1 and 2. we've administered approximately 18,000 first and second doses by the health department. Just a moment, we're going to try to mute a line. If you are on the phone, if you've called in, we need you to mute your line, please.
It was just that one. What? It was just that one.
Currently speaking, we can, please mute your line. We can't see you, if you're called in, we can't see you.
It can sit here. It doesn't matter to me. It can sit here. I'm not fixing going through all that. We're not getting through all that. We're not. So just let it go. You do whatever you want to. Just, I'm not trying to go. I'll change it, let it go. Let it go.
Okay, thank you. Thank you to our wonderful IT staff. All right. So currently we're vaccinating in groups 1 and 2. So far, and this doesn't include today's data, and probably only a portion of Monday's data, administered 18,000 first and second doses by the health department. The state health department has a great dashboard where you can see our numbers by county, and it shows that we've administered, or the 45,303 Cumberland County residents have been received their first and second doses. A few key points to remember about that number is that it doesn't include anybody that has been vaccinated through the long-term care facility partnership with CVS or Walgreens, and it does not include anybody vaccinated specifically by the VA or by Fort Bragg. So it's likely an undercount because we know those are significant portions of our population, but those are federal assets and come directly from the feds and don't filter through the state. As of today, we are suspending our first dose appointment request temporarily as we get ready for group 3. So we are getting ready for group 3, and I'll talk about when that phase is going to open on the next slide. But we have a pretty long wait list. We have a wait list of about 2,700 people on that wait list right now before we even get to our next larger group in group 3. So we're pausing those first dose appointment requests so we can catch up on filling those appointment requests with the doses that we do have. And then that will also allow us to get ready for what group 3 is going to look like when we reopen that on Monday. So we're pausing for the remainder of the week, and then we'll reopen on Monday. And when we reopen on Monday, some of the individuals, based on the state prioritization, will be able to request appointments beginning on Monday. So we are continuing, however, to take second dose appointment requests. So if you've already received your second dose, individuals can continue to request that second dose appointment from us, and we don't want that to be a barrier. So just no first dose appointment requests for right now. Our next group is group 3. And as you may have heard, last week, the governor announced that they're breaking out group 3 because of the size of group 3 into some subcategories. So on the next slide, we'll kind of jump into that just a little bit. So group 3, this first breakout group is going to include school and childcare workers who are in person or who will be in person pretty immediately, including staff who are our cafeteria workers, our individuals that are cleaning the buildings, our teachers, our counselors, our support staff. All of those individuals will be eligible in group 3 as long as they are in a pre-K through 12 setting, or if they work in a daycare. So, or in any role in that daycare, a staff or a volunteer that works in those particular places. So it's not all educators. It does not include our university staff or our higher education staff, and they must be in person and they must be in a school setting, whether that's a private school or a public school. So it does not include our folks that are homeschooling individuals, and it does not include some of our after-school programs. We will have people in this phase self-attest to that when they get to the vaccination site, and we'll ask some screening questions to determine their eligibility at the vaccination site. So their eligibility opens per state guidelines on February the 24th. I want to help manage expectations a little bit. We mentioned that we have a pretty long wait list of about 2,700 people that are still on our wait list for first dose appointments, and we're scheduling out a couple of weeks already. So appointments may not immediately be available for individuals on February 24th. However, we will have some standby lane slots available, and so those individuals that are not able to get an appointment can still use that standby lane if you are an educator or if you're a teacher or child care worker beginning on February 24th. So the group after that is our, one more slide next, please, thank you, is our frontline essential workers. And I want to get some clarifying language the best I can about who is a frontline essential worker. The CDC has provided some very specific guidelines about who are the essential workers that we are specifically addressing in this category. While we've used the term sort of loosely over the last year, I think in general conversation, but the guidelines from the State Health Department and the CDC are pretty specific about who is considered an essential worker in group 3. And those individuals must be at work in person or at their place of work. And they fall into one of 8 essential sectors that are specified. And that's critical manufacturing, essential goods, which we consider a grocery store, or if you provide maybe like a pharmacy or a place that provides medicine, food and agriculture. So our farmers, our migrant farm workers, our individuals that work in grocery stores, or individuals that work in restaurants, our government and community services. So that includes members of the clergy, our court officials, some of our individuals that work in the courthouse where we're seated right now. Healthcare and public health, if they for some reason already have not been vaccinated. That also includes our social workers, are included in group 3, and public safety and transportation are also included in group 3. Their eligibility opens on March the 10th. And again, I want to manage expectations a bit here because again, our teachers and our daycare workers and our groups 1 and 2 can still continue to request appointments. And we're going to make that live back on Monday. So we anticipate that that wait list is going to grow depending on our weekly allocation from the state. So even though eligibility opens on March the 10th, individuals may not be able to get an appointment on March 10th when that phase opens. That just means they're becoming eligible, and we're going to continue to manage and remove people off of our wait list into the appointment phase as quickly as we possibly can based on our allocation. The next slide, these are the lists of current vaccine providers that actually have vaccine. Cape Fear Valley, of course, health system continues to vaccinate. They have 2 locations at the rehab center and then at Health Pavilion North. Walgreens and CVS are continuing to vaccinate in our long-term care facilities. And I'll note that we have been, for those long-term care facilities that have not enrolled in that federal partnership, we are picking up those vaccinations, and the health department has been going to those facilities that did not enroll to vaccinate. And we've also vaccinated a few other types of residential care facilities where they have a large group of seniors. Stedman Wade is also an enrolled provider, and Goshen, our 2 FQHCs are also enrolled providers. Although statewide, Goshen, the network that is Goshen, has reallocated many of their doses to local health departments, and we're grateful for that partnership. Fort Bragg and the VA, again, also continue to vaccinate individuals as well. Last week, Walgreens, separate from the CVS and Walgreens partnership for long-term care facilities, Walgreens at 7 stores in our area began or will begin administering vaccines to eligible participants. So they are following the guidelines for those that are eligible in North Carolina, and there's they have a website where individuals can go to schedule an appointment online. And I'll note that their doses are limited. I believe they are receiving approximately 100 doses, and that is separate than the allocation that is coming directly to North Carolina. So they're getting their allocation separately than what is the local health department allocation and the hospital allocation. So we are anticipating, as we prepare for group 3, some schedule changes. So on the next slide, we have some schedule changes that we're going to kind of slowly roll out. Currently on Tuesdays, we do second dose only. That is because we typically get our shipments on Tuesdays for first doses, and we can't roll the shipment out the same day that we get it, especially if we're not sure that it's what time it's exactly going to come. So we maintain Tuesdays for second dose only. In order to clear out that wait list, we've expanded the number of appointments that we have, and we're going to have less standby time and more appointments available. So on Tuesdays, we're filling appointments from 8 a.m. to 5 p.m. for second doses only. Wednesdays, we are making that day our sort of hybrid day. We'll do second doses in the morning by appointment, and then first doses in the afternoon by appointment, and we'll book those helping individuals. On Fridays, we will do first doses only, and we'll have appointments, and then we will switch in the afternoon to have our standby lane. So for folks that are used to coming all the time in the afternoon and standby, we are really pushing that to Friday. It makes it quite a challenge in our parking lot, and let me say many thanks to our emergency management staff who help us manage, and the Crown staff who help us manage our parking lot operations, and our individuals from the Civil Air Patrol and the CERT team, and our individuals from the National Guard who help us kind of manage our parking lot operations. It makes it very confusing in the parking lot when we're giving first and second doses of Moderna and Pfizer, and we're doing appointments, and we're doing a standby lane. It is quite the challenge. So we're trying to streamline this and make it a little bit simpler so that really our standby lane gets pushed to Friday for anybody. That's the time when we'll have anybody that is eligible. So if you are eligible, but you have not been able to get an appointment, Friday is the time to come to our site. So for example, when we open to teachers and daycare workers next week, if they're not able to get an appointment right away, that standby lane is still where we want them to focus, because they may not be able to get an appointment right away. Again, that standby lane is still for people that are eligible in the current phases. We are, for people that are already scheduled, we're scheduling people out into March already. We are keeping your appointment schedule. So if you already have an appointment, we've already booked you, you keep that schedule, even if it's a little bit off, even if you're a second dose or on a Friday, but we've already scheduled you, we're going to maintain that schedule. But we're going to phase in this new schedule to kind of smooth out operations for us on our side. Again, so if you're already scheduled, don't panic. You keep your appointment the way that you have it. We are doing second dose appointments automatically. At the end of last month, we started automatically scheduling people for their second dose. So if you came to us at the Crown on January the 27th or after, we will ask you what time you'd like to come back for your second dose appointment. And then in the few days following that, we send you an email confirmation to confirm your second dose appointment. So if there are individuals that have not yet received their second dose and they got served before January 27th, they can call us right now, or they can request an appointment online for those second doses, and we're prioritizing making sure that those second doses get scheduled. A couple of other non-COVID updates on the next slide. Dr. Ojo last meeting requested a report out from our local health department meeting. We have not had a local health department meeting of the large association, our monthly meeting, since our last Board of Health meeting. It's actually on Thursday. So we're the weeks are a little bit off this month. But I'll give a report out from our last month's meeting, our January meeting. We were joined at that meeting by Secretary Cohen and Governor Cooper. So it's great to hear their perspective. This was about almost a month ago when we did our really big push. So I think they were, if I remember correctly, they were really pushing and encouraging us to get all those first doses off the shelf. So they had an opportunity to hear some of the thoughts and the feedback from our local health departments about how rollout was going, some of our challenges, some of the successes, and really had a chance to talk with them. So in addition, we were provided COVID vaccine updates. So much of the information that we presented to you come out of those meetings. And we use that time with the state health department staff to, again, get feedback from them about and plan their plans for vaccination efforts, what's going on statewide, big 30,000-foot view, and then also give feedback and give us an opportunity to ask questions about the rollout or very specific questions and things that we're hearing on the ground that we need their assistance. In addition, we were provided an update about Medicaid transformation. So as a reminder, Medicaid transformation goes live on July 1st, 2021. So we'll be working with our partners across the state and with the providers to make sure that we're ready for Medicaid transformation. It's still in there even with COVID. And so we are still working in that direction. And towards the end of the meeting, we also were provided an accreditation update. So one of the challenges, of course, with COVID is that much of the attention of local health departments shifted to COVID last year in the spring. And then since then, of course, now has even shifted and pivoted even harder towards our vaccination efforts, which means some of our accreditation requirements are getting more and more challenging to meet because all of our staff and focus and attention is on COVID. So the board had the opportunity, or the association had an opportunity to weigh in and vote on what our requirements are going to be for accreditation, and those will be taken up to the state accreditation board. Nothing has been given final approval. Last year, if you'll remember, they temporarily gave us an extension for accreditation. We got a 1-year extension for accreditation, and the local health department directors are requesting the same an additional extension because we are just, all of our attention right now is focused so much on COVID that some of those requirements are more challenging to meet as we're not able to, as we're auctioning out at vaccination sites. And then finally, one of the report outs was about a Board of Health training that is going to be available online, and I believe it is live and available now. So when you get your minutes, you'll have this link in your slide. But there is Board of Health online training available now. Some of the information is similar to what you have in your packet, in your operating procedures and the public health laws and evaluations. But this is some additional training opportunity for board members if they like to have it, and we'll make sure that that link gets sent out to you so you have it. And one more, just a few other updates from me. One is about our electronic health record. So if you will remember, if you've been around for a while, and even predate me, the health department has sought a new EHR. Our current EHR, the functionality of that is currently limited and isn't even being supported by the current vendor right at the moment. So our contract with them ended. So we sought in late last, or the year before last, before my arrival, participated in and initiated an RFP process for a new electronic health record. Some of that process in the fall of 2019, the health department staff participated in demonstrations with the vendors that submitted an RFP. That process was then a little bit delayed by COVID and frankly, a little bit the weather. If you remember last year, we had some site visits scheduled and some of those got delayed. And then COVID hit right around there. So we are circling back to that, and we took it to the Board of Commissioners. We made a a selection with county management about which each EHR we would like to have, and at the health department in collaboration with our IS team and county management, and took that to the agenda setting session last Thursday to be put on the commission meeting yesterday. So it went to the agenda setting session last Thursday, got approved to go on the agenda last night at the commissioners meeting, and then was ultimately last night approved the recommendation from county management to select CureMD as our new electronic health record. So that was approved and passed by the commissioners last night. And so we will move forward with CureMD as they were the successful bid for our new EHR. And a few other small updates. Our long-awaited social worker position that the commissioners graciously approved last summer. And we took some time to make sure we got the position description exactly the way we wanted it and then found the right fit. That person started on Monday. His name is Orlando, and we'll bring him to a commission meeting. He's still in orientation, and we'll bring him to a Board of Health meeting so you can all meet him, but we're excited to have him here. If you remember from our strategic plan, his position is sprinkled quite a bit in that strategic plan. So we're excited about having him here, and we'll have him to come to a Board of Health meeting so that you can meet him. Finally, two plans that the board looked at last year and that you've been hearing about are close to being finished. Our strategic planning report is close to completion. We're putting some final touches on that. It will be ready for your final approval and publication here in the next month. And then the same thing with our quality improvement plan. We are working on the final writing of the quality improvement plan. Many of our programs have already launched their QI projects, although some of them have been delayed because of COVID, especially as our attention shifts to vaccinations. But I did want to let you know that we are still moving forward with both of those efforts on our QI plan and our strategic plan. So that was a lot of updates, and I'll pause there to see what questions you have.
I had a question. So just to ask about, the availability of vaccinations. So you said that there's like 2,700 people on the wait list?
Correct.
So like say for instance, I was talking to one of my patients, because I've been pushing the COVID vaccine for my patients. And so like I was talking to her today, she said that she got her vaccine yesterday. And it was interesting, that you tell me that there's a wait. She said that she just woke up in the morning, had a leisurely morning, and then went out to Grace Creek in the parking lot and got her vaccine, no wait. And there was only like 5 people there. So when you say that there's a wait list, can people be directed to less busier sites to try to decrease that wait list? Because I hate to hear that vaccine is being wasted and that people aren't getting vaccinated.
So we're not wasting any vaccine. So yesterday, Monday, because we heard lots of feedback about, I've been waiting for my appointment, the wait list is long. We wanted to make sure that we gave people an opportunity to get vaccinated before this group 3 started. And so we did a big push yesterday to get the 65 and older group out to come to the Crown with no appointment needed. Come out, please don't let not getting an appointment be a barrier. Please come out. We had a lower turnout than we expected yesterday, but we did not waste any doses. We limit pre-drawing as much as we can. We do pre-draw, but especially as we get towards the end of the day, we are not going to open a lot of vials at the end of the day if we don't have the crowd there, so that we don't waste any doses at the end of the day. So we are very intentional about not wasting doses and putting every available, giving every available vaccine that we have, that where the vial has been open, and not wasting any of them.
Can people be called up off the wait list and say, hey, we're open, come on?
So usually we have, so yesterday we did a Cumberland alert, we did social media, and then I sent an email out to some of our community partners to make sure that they knew that we were open yesterday. And then, and the same thing, I think one of the challenges is we know that people I'll say kind of appointment shop, if you will.
Yeah.
Hop on different wait lists. And so they're on 4 or 5 different wait lists. And then when we schedule them, they either don't show up or they cancel. And so it throws off our counts a little bit because they don't show up because they've already gotten their vaccine somewhere else. So we're aware of that, and that's why we try to have that standby time at the end of the week now, so that people, so that we're using our first doses up, and we're not just relying on those that come to their appointments. So we see a lot of appointment shopping, if you will. That's the best way I can describe it.
Yeah, I had heard about that on NPR. So it's hard to know what is a true wait list.
Right.
Because people are, like you said, trying to get in somewhere.
Right. So what we do before we schedule an appointment, and the credit here goes to Candy and her team, before we schedule their appointment, we try to make sure that they are, because we can see in our COVID vaccine management system where everybody, if they've already been scheduled or if they've already received their first dose, we'll take that wait list before we schedule them. We'll check in the system to see if they've already been received their dose somewhere else. But that doesn't mean between the time we schedule them and the time they come that they don't already have 2 appointments booked somewhere else, even though they're off our wait list. So we have about, I'd say at least a 15 to 20% no-show rate. So we try to account for that when we book appointments.
Is that board training optional, or is that something that required that we have to do?
So there's one more, thank you, one more item in your packet. There's a board of health training. The one from UNC is not mandatory. And then there is an additional National Association of Local Board of Health Training or symposium that you can find in your packet. And that's on March 24th. It's virtual. And the registration is linked to your registration is in your packet. So if you'd like to attend, please let Kelly know so we can get you registered and signed up for that. But neither one of those is required, but those are both options for you to attend.
The NALBO symposium, just to kind of talk about that, because I'm one of the directors on the NALBO. So it's actually supposed to be planning for it to be really nice. Supposed to have national speakers trying to get in folks from Johns Hopkins, the CDC, the NIH, Big Pharma to come in and talk about the vaccine, looking at national and local responses, rural versus urban responses. So it's really supposed to be a nice symposium for everyone. So hopefully as many folks can attend as possible. And also NABO is still planning on having the national annual conference the first week in August 1 through 3rd. So to date is planned on being in person, but that may change.
You can send Kelly an email if you would like to attend, and we'll get assistance with the registration.
Thank you. Thank you very much. Anybody has any questions or comments for Dr. Green? Any questions, comments? We need all board members to please support and advocate for public health and the health department. So if you are available for the symposium on March 24, please let Ms. Kelly know so she can register us. Thank you. If there's no questions for Dr. Green, we'll move on to the next item on the agenda. Thank you, Dr. Green. I want to implore board members to please review the attendance roster and communicate any discrepancies to Ms. Kelly. Do we have any comments, please? Questions from board members? Questions, please, comments, board members? If there are no other questions, comments, I would like to mention that you can please read through the clinic reports on pages 48 through 58 in your packet. Also, please mark your calendar for the next meeting on March 16 at 6 p.m. And if there's any item or items that you would like to be included on the next agenda, please let me Kelly know ahead of time. If there are no more questions, comments, can I please have a motion to adjourn today's meeting?
I'll make a motion, Dr. McMahon.
Thank you, Dr. McMahon. Second?
Mr. Larch, I second.
Thank you, Mr. Larch. All in favor?
Aye.
Thank you. Have a very great weekend and please be safe.
Thank you.
See you March 16th. Thank you.
Thank you. Good night.
Good night and have a nice evening.
Thank you.